the system is broken. You have a number of patients that need other medical services, potentially life-saving medical services, but they can't get the basic dental care they need.
I have mantle cell lymphoma cancer. It's important to get the dental work before I start treatment.
I was on a race against time because I had no idea how I was going to get the dental work. And without the dental work, I wasn't going to get a kidney.
I was told that if I didn't get my dental work done, that he could not, go on with the heart surgery, because if there was any infection from my mouth, it would go directly to my heart and it would just be, for naught.
Infection is the number 1, 2, and 3 killers in our patients. A common source of the infection can be in the teeth.
Often dental care is overlooked and is really important to the overall care of the patient, and we can't afford to overlook these things.
Yeah, because of my kidneys, I was forced out of work. The first thing that went was my dental plan. I couldn't afford it.
I didn't have dental care, and I couldn't afford to get my teeth pulled and to get the operation.
The average patients who is now disabled on Medicaid have very limited access to dental care, and so these patients require coverage. So where are you going to get that?
They don't know where to go. They don't know that we exist, that we are, in a system. So what Donated Dental does is it coordinates services for people in need that can't get services elsewhere. All of our services are donated, whether it's the dentist that's donating it, the lab, or the specialist.
A good case manager is critical to any program succeeding because a lot of these patients don't have the access.
We need more case managers to bridge the gap between our medical and our dental needs of our patients.
Funding is needed to help the case managers access the services that are out there. Without enough people to do the outreach and identify the need and the way to treat that need, these people are just in limbo.
A lot of times the government programs feel that they have to cut on things that they don't think are necessary or exorbitant, meaning that they're not critical to saving a patient's life. And here's an example of poor dental care which could actually kill the patient after surgery.
That's patients that are in need of artificial heart valves, in need of dialysis. If they cannot receive the necessary dental care that they require in order to have those procedures, they're going to be maintained for much longer periods of time.
The inability of the government to provide this for people is ultimately costing more money than if they just provided it up front.
When a patient have a dental complications, they have a huge abscess, they need IV antibiotics. You put them in the hospital. Each night in the hospital is going to cost you a couple $1,000s. And you add on it imaging, antibiotics. We're talking about $3,000, $4,000 a night. For 10 nights, that's $30,000, $40,000. You could have fixed this patient's problem with a couple office visits that may cost only $1,500. So it doesn't take a mathematician to figure out that's a huge saving for the society.
I got my heart done, and so far, so good. Everything's working out very well.
Getting the dental work done is going to allow me to move forward with the cancer treatment. Health-wise, is going to be a very good benefit for me.
I got a new smile, new kidney, everything's looking good.
I'm living proof that, donated dental helps.
It's important for people who work in government and who write legislation to understand how critical it is that people be able to access affordable dental treatment.
We have the patients who really need the dental care. We have the dentists who really care about these patients, and they actually donate their time to serve these patients.
I hope that a network can be developed where donated dental services is available to all states and our entire population, because it certainly has proven to be an effective way to treat medically compromised patients in need of dental care.